In this video, we'll be covering 24 of the most common certified nursing assistant interview questions, each one with a high converting sample answer that you can use right now during your interview. Here's a bonus tip. Study the job description before your interview. This way, you can add specific qualification requirements to your answers to better match them with the expectations of the job role. Let's get started. Question number 1. Tell me about yourself. Thank you for the opportunity to sit down with you today and interview for this CNA position. I received my certification after completing an accredited training program where I gained extensive hands-on experience through clinical rotations. This training helped me develop essential skills in patient care, including assisting with activities of daily living, taking vital signs, and providing mobility support. I've worked in a variety of healthcare settings where I've had the opportunity to care for patients with diverse needs and health conditions. My experience includes working in elder care, where I focused on creating a compassionate environment for residents while attending to their physical and emotional needs. I'm particularly passionate about improving patients' quality of life, which I believe starts with patient-centered care and effective communication. I'm skilled in documenting patient information accurately and efficiently, and I have a strong understanding of privacy and ethical standards in healthcare. I'm also known for my ability to work effectively in team settings, collaborating closely with nurses and other healthcare professionals to ensure the best possible care for our patients. I'm excited about the possibility of bringing my skills and passion for patient care to your team, and am eager to contribute to your commitment to excellence in healthcare. Question number 2. Why do you want to work here? When crafting an answer to why do you want to work here for a certified nursing assistant interview, it's important to emphasize your passion for patient care, your commitment to the healthcare field, and how the specific facility aligns with your career goals and values. Here's a sample answer. I am eager to join your team because I admire the high standards of care and the compassionate environment that your facility is known for. Throughout my previous experience as a certified nursing assistant, I have developed a deep passion for providing supportive and empathetic care to patients. I've found that actively contributing to a patient's recovery and comfort not only supports them but also gives me a profound sense of fulfillment. I am particularly impressed by your facility's commitment to continuous improvement and education in patient care, which I believe is crucial for addressing the complex needs of patients effectively. I see this as a wonderful opportunity to further develop my skills with the support of a renowned institution that prioritizes both patient and employee well-being. This alignment with my own values of care and professionalism makes me excited about the prospect of working here and contributing to your team. Question number 3. What do you know about us, this company, or healthcare facility? When preparing to answer the question, what do you know about us, during an interview with a healthcare facility or company, it's crucial to show that you've done your homework. This not only reflects your interest in the position, but also your diligence as a professional. Here's how you can structure your answer. Research the facility. Before the interview, thoroughly research the facility. Look up their history, mission, the types of services they offer, any specialties they are known for, and their community involvement. Also, if available, review their latest news or any recent achievements. Align with their values. Highlight how the facility's values and goals align with your own professional ethics and goals. This shows that you are not just interested in any job, but are particularly motivated to work there because of what they stand for. Mention recent news. If the facility has been in the news recently for positive reasons, such as awards, innovations in patient care, or community service, mentioning these can be a great way to show your current knowledge about their activities and to express admiration for their achievements. Let's look at a great sample answer. I have always admired, you can mention the facility name, for its dedication to both excellence in healthcare and compassionate patient care, which align with my own professional values. I understand that your facility is not only a leader in, you can mention any specific medical field or service they are known for, but also deeply committed to community outreach programs. Recently, I was impressed to learn about your initiative. Mention any recent project or achievement, which I believe is a great example of how healthcare can extend beyond traditional boundaries to really make a difference in the community. Your commitment to innovative care and community engagement makes me excited about the possibility of contributing to your team. Question number 4. Do you have any experience working as a CNA? Here's a great sample answer. for a candidate with experience. I do have experience working as a certified nursing assistant, and over the past few years, I've had the opportunity to work in both a hospital setting and a nursing home. In these roles, I provided direct patient care, including assisting with daily living activities, monitoring vital signs, and implementing care plans under the supervision of registered nurses. My experience has equipped me with strong communication skills, a thorough understanding of patient care protocols, and a deep compassion for helping those in need. I am confident in my ability to effectively support the nursing team and provide excellent care to patients. Now, here's a great sample answer for a candidate without experience. Although I am new to the role of a certified nursing assistant, I am fully committed to providing compassionate and high-quality care to patients. During my training, I participated in various practical exercises and simulations that helped me develop a solid foundation in patient care, including vital signs monitoring, patient hygiene assistance, and effective communication with both patients and healthcare professionals. I am eager to apply my training in a real-world setting and am confident in my ability to learn quickly and adapt to the needs of your team. I am enthusiastic about starting my career and contributing positively to patient outcomes. Question number 5. What would you do if a patient refused care? How would you handle it? When faced with a situation where a patient refuses care, I first ensure to approach the matter with empathy and respect for the patient's independence. I would calmly ask the patient to express any concerns or reasons for their refusal, as understanding their perspective is crucial. I believe in educating patients about the benefits and importance of the proposed care in a non-confrontational manner. If the refusal persists, I would respect their decision but document the interaction and inform my supervisor or the patient's nurse to ensure continuity of care and that all protocols are followed. My priority is always the patient's well-being and safety, balanced with respect for their preferences and rights. Question number 6. What do you do when entering a patient's room? Whenever I enter a patient's room, I start by knocking and waiting for permission to enter to respect their privacy and dignity. Once inside, I introduce myself and explain the purpose of my visit, which helps in building a connection and makes the patient feel respected and informed. I then perform hand hygiene and make sure to check the room for safety hazards. I also ensure to check the patient's identification to confirm I am providing care to the right individual. Throughout the interaction, I stay attentive to the patient's needs and comfort, making adjustments as necessary to ensure they feel secure and cared for during my visit. Question number 7. In your previous job, if you called off work, what did you usually call off for? In my previous role as a certified nursing assistant, I maintained a strong commitment to my work schedule and responsibilities. I rarely called off, but on the few occasions I did, it was typically due to significant personal health issues like a severe flu to ensure I did not compromise the health of the patients under my care. Ensuring patient safety and wellness has always been my top priority. Question number 8. Why do you feel qualified to work here? What makes you a good patient care individual? I feel highly qualified for this position due to my comprehensive hands-on experience in patient care across various settings. Over the years, I've developed a keen ability to handle both the physical and emotional needs of patients, which is crucial in a healthcare environment. My previous roles have developed my skills in vital signs monitoring, patient hygiene, documentation, and support during medical procedures, ensuring that I can provide attentive and compassionate care. Additionally, I possess strong interpersonal skills, which are vital when interacting with patients, their families, and other healthcare professionals. My ability to communicate clearly and effectively helps in providing patients with a sense of comfort and understanding, which I believe is as important as the medical care they receive. My dedication to fostering supportive and safe environments for patients to recover and feel valued makes me a good fit for your team. I believe that my experience with time management and adaptability, especially in fast-paced and high-stress environments, ensures that I can meet the demands of this role while maintaining high standards of care. This combination of technical skills and soft skills, I believe, makes me a strong candidate for this position. Question number 9. What do you believe are your professional strengths? In my previous roles as a certified nursing assistant, I've developed a strong set of skills that I believe would contribute significantly to your team. One of my key strengths is my ability to communicate effectively with patients and their families. I understand the importance of clear, compassionate communication, especially when patients are in distress or facing difficult situations. Another strength is my attention to detail. In my experience, even small aspects of patient care can make a big difference in their recovery and overall comfort. I always ensure that I adhere to all protocols and maintain a high standard of care. Additionally, I have a strong track record of working well in team settings. I believe that collaboration with colleagues is crucial in a healthcare environment. I've been commended for my ability to support my coworkers and contribute to a positive, productive work atmosphere. I'm very adaptable and can handle stress effectively, which I think is essential in the fast-paced environment of healthcare. I'm confident that these strengths will help me make a positive impact in your organization. Question number 10. What do you consider your weaknesses? One area I'm actively working on is my comfort with technology. In my previous roles, I've noticed that newer digital record-keeping systems can sometimes be a challenge for me. I recognize that being proficient with these technologies is crucial for efficiency and accuracy in patient care. To address this, I've been dedicating time each week to improve my skills through online tutorials and practice. Additionally, I sometimes find it difficult to delegate tasks because I take great pride in my work and want to ensure everything is done to the best possible standard. Over time, I have come to realize the importance of teamwork in a healthcare setting, and I'm learning to trust my colleagues more and share responsibilities effectively. This not only helps me manage my workload, but also enhances our team's overall productivity and care quality. Question number 11. Why should we hire you rather than other candidates? I believe my experience and personal qualities set me apart as a strong candidate for this position. Throughout my time as a CNA, I have developed a deep understanding of patient care, demonstrating compassion, patience, and resilience in every aspect of my work. My previous roles have equipped me with hands-on skills in providing both emotional and physical support to patients. I have experience with a variety of patient care protocols and am skilled in tasks such as taking vital signs, assisting with daily living activities, and managing emergency situations. I have consistently received positive feedback from my supervisors for my ability to work well in a team and take initiatives in improving care procedures. My focus has always been on providing the best possible care and comfort to patients, ensuring their needs are met with dignity and respect. I am also committed to continuous learning and improvement. I stay updated with the latest in healthcare practices and have participated in additional training sessions to enhance my skill set. In this role, I am eager to bring my strong work ethic, proven skills, and passion for patient care, making a positive impact on your team and the lives of your patients. Question number 12. What do you consider your areas of expertise? In my career as a certified nursing assistant, I've developed several areas of expertise that I believe would be valuable in this role. First, I have extensive experience in providing compassionate care to a diverse patient population, which includes monitoring vital signs, assisting with daily living activities, and managing mobility needs. I'm particularly skilled in geriatric care, having spent significant time in nursing home settings where I refined my ability to offer personalized support to elderly patients. Additionally, I pride myself on my communication skills. I've learned how to effectively communicate with patients, family members, and healthcare teams to ensure that all care needs are met and that everyone remains informed about patient conditions and progress. I've also gained strong organizational skills through my previous roles, which help me manage patient schedules, treatments, and documentation efficiently. This ensures that care is timely and in line with healthcare protocols. I'm eager to bring these skills to your team and continue developing my expertise in a supportive and dynamic environment. Now, before we continue, check out these awesome videos. I have posted the links to them in the description below. Also, don't forget to like and subscribe to my channel for more great videos posted every single week. Question number 13. What do you enjoy most about being a CNA? One of the things I enjoy most about being a CNA is the direct impact I can have on the quality of life of my patients. Having worked in both nursing homes and hospital settings, I've seen how personalized care and attention can significantly improve a patient's day. It's incredibly rewarding to assist with daily needs and to be a familiar, comforting presence in their lives. Additionally, I appreciate the teamwork involved in healthcare settings. Working closely with nurses and other healthcare professionals has deepened my understanding of patient care and enhanced my skills. Every day offers new learning opportunities and the chance to make a real difference in someone's life, which I find very fulfilling. Question number 14. What has been your greatest achievement in your career thus far? One of my greatest achievements in my career as a certified nursing assistant so far was during my previous role at a long-term care facility. I was particularly focused on improving the quality of life for a group of residents with dementia. Recognizing the challenges they faced in their daily routines, I initiated a small program that involved personalized music playlists for each resident based on their past preferences and life history. This initiative required detailed conversations with family members to gather insights into the residents' histories and personal tastes, as well as collaboration with the rest of the healthcare team to integrate this program into our care strategy. Over time, we observed remarkable improvements in the residents' moods and engagement levels. Some residents who previously were withdrawn and non-communicative started interacting more with staff and fellow residents, showing signs of happiness and reduced agitation. The success of this program not only enhanced the residents' quality of life but also brought their families immense joy seeing their loved ones respond so positively. This experience has been profoundly rewarding for me as it reinforced the importance of tailored, compassionate care in improving patient outcomes. It's an approach I'm committed to in my professional practice and continue to build upon with each new experience. Question number 15. What techniques do you use to practice self-care and de-stress? In my role as a CNA, I've found that self-care is crucial to maintaining both my physical and mental well-being given the demands of the job. To manage stress and take care of myself, I prioritize several techniques. First, I ensure that I maintain a regular exercise routine, which helps to reduce stress and keep me physically fit. I find activities like walking or yoga particularly beneficial after a long shift as they help to clear my mind and relax my body. I also practice mindfulness and meditation. Even short sessions can significantly lower stress levels and improve my focus, which is essential in providing attentive care to patients. Additionally, I make sure to schedule regular check-ins with myself to assess my mental health and overall well-being. If I notice any signs of burnout, I discuss these feelings with a supervisor or a colleague. This open communication helps to address any issues early and supports a healthy work environment. I also ensure that I maintain a healthy work-life balance by dedicating time to hobbies and spending quality time with family and friends. This balance is crucial for rejuvenation and helps me return to work with renewed energy and a positive outlook. These self-care techniques have greatly assisted me in handling the demanding aspects of my job effectively while ensuring that I remain compassionate and efficient in caring for my patients. Question number 16. Can you describe the various stages of a pressure sore? From my previous experience as a CNA, I've learned that pressure sores, also known as bed sores or pressure ulcers, develop in 4 main stages, primarily affecting individuals who are bedridden or immobile for extended periods. Stage 1. The first stage is the mildest. The skin isn't broken at this point, but it may appear reddened on lighter skin or differently shaded on darker skin and does not blanch when pressed. The area might be tender, painful, or warmer or cooler compared to the surrounding skins. Early detection and preventive care are crucial at this stage to prevent progression. Stage 2. In the second stage, the skin breaks open, wears away, or forms an ulcer, which is usually tender and painful. The sore expands into the deeper layers of the skin and can look like a scrape, blister, or a shallow crater. At this stage, proper cleaning and dressing of the wound are vital to promote healing and prevent infection. Stage 3. This stage involves the full thickness of the skin and may extend into the subcutaneous tissue layer that lies just below the skin. The sore develops into a deeper crater with potential for fat visibility in the wound. Management includes more extensive wound care and often requires the expertise of healthcare professionals to manage infection and other complications. And finally, stage 4. The most severe stage, where the sore is very deep, reaching into muscle and bone and causing extensive damage. Damage to deeper tissues, tendons, and joints can occur. Treatment for stage 4 pressure sores is complex and can include surgery, advanced wound therapy, and significant interventions to relieve pressure and treat the wound. In addition to these stages, there are also unstageable pressure sores, where the bottom of the sore is covered in yellow, tan, gray, green, or brown material and cannot be seen. Another category is a deep tissue injury where the skin is intact but the tissue underneath is damaged from pressure. Question number 17. Give me an example of a time you had to deal with a difficult patient. In my previous role as a certified nursing assistant, I once cared for an elderly patient who was particularly resistant to receiving help with daily activities due to a strong desire for independence. This patient would often refuse assistance with personal care and sometimes respond with anger. Understanding the importance of empathy and patience in such situations, I took the time to build a rapport with the patient, ensuring to communicate openly about the care process and how our efforts were aimed at maintaining their dignity and independence. I also involved them in decision-making as much as possible, which helped reduce their resistance over time. On one occasion, the patient became very upset when I attempted to assist them with bathing. Recognizing their distress, I paused and offered a calming presence, listening to their concerns. We discussed alternatives and reached a compromise that allowed for partial independence while ensuring their safety and hygiene. This experience taught me the value of patience, active listening, and flexibility in care. It also underscored the importance of adapting approaches to meet individual patient needs and comfort levels. Question number 18. How would your previous colleagues and supervisors describe you? I strongly believe that my colleagues and supervisors would likely describe me as dedicated, compassionate, and reliable. I've always been committed to providing the best care possible to our patients, focusing on their individual needs and ensuring they feel comfortable and supported. My previous supervisor often commended my ability to handle stressful situations with calmness and professionalism, which I believe is crucial in healthcare settings. Additionally, my colleagues might mention my teamwork skills, as I consistently strive to support my team and contribute positively to our work environment. I believe these qualities would make me a valuable addition to your team as well. Question number 19. How do you prioritize patients when managing several at a time? In my previous experience as a CNA, I've developed a systematic approach to prioritize patients effectively. I start by assessing each patient's condition, noting any urgent needs or critical issues. Patients requiring immediate attention, such as those experiencing acute pain or respiratory distress, are addressed first. I also consider the complexity of care required for each patient. Those with more complex medical conditions or those who are less stable may need more frequent monitoring and assistance. Additionally, I prioritize based on scheduled treatments or medications. Patients with scheduled procedures or medications are attended to promptly to ensure they receive their necessary care on time. I also take into account each patient's personal preferences and individual care plans. Respecting their independence and dignity, I prioritize tasks in a way that aligns with their preferences and promotes their overall well-being. Finally, I continuously reassess the situation and adjust priorities as needed. Flexibility is key in healthcare, and I remain adaptable to sudden changes or emergencies that may arise. Overall, my approach to prioritizing patients involves a balance of urgency, complexity, scheduled care, individual preferences, and adaptability to ensure all patients receive high-quality care tailored to their needs. Question number 20. Give me an example of a time when you collaborated effectively with other medical staff members. In one of my previous roles, I worked closely with nurses and other certified nursing assistants in a high-pressure environment on the cardiology unit. One evening, we were particularly understaffed and faced with a higher than usual number of critical patients. I noticed that one of our patients, who had recently undergone surgery, was showing signs of distress. Recognizing the urgency of the situation, I immediately informed the nurse in charge. While the nurse attended to the patient, I coordinated with other staff members to ensure that all other patients were being monitored and cared for. I also assisted in gathering necessary medical supplies and equipment to save time. This teamwork and effective communication allowed us to stabilize the patient until further medical help could arrive. This experience reinforced the importance of collaboration, clear communication, and readiness to support my colleagues in critical situations. It was a reminder of how teamwork is vital not just for our success, but for the well-being of our patients. Question number 21. Tell me about a challenge you faced at work and how you overcame it. One of the biggest challenges I faced was dealing with a high-stress situation involving multiple patients needing urgent care simultaneously. This occurred during a particularly busy shift where we were understaffed due to unexpected absences. To handle this, I prioritized patient needs based on the severity of their conditions, using the training I received in triage processes. I communicated effectively with the nursing team, ensuring that everyone was aware of the critical situations and could respond accordingly. Additionally, I utilize my organizational skills to efficiently manage my responsibilities, ensuring that each patient received timely and appropriate care. Throughout the situation, I remained calm and focused, which helped maintain a positive environment and ensured that we provided the best care possible under the circumstances. This experience taught me the importance of communication, teamwork, and staying composed under pressure, which are crucial skills in a healthcare setting. Question number 22. Where do you see yourself in 5 years? In 5 years, I see myself having gained extensive experience as a certified nursing assistant, contributing significantly to the healthcare team I work with. My goal is to develop a deeper understanding of patient care, especially in geriatric and palliative care, which are areas I am particularly passionate about. I plan to continue enhancing my skills through on-the-job experiences and additional certifications that will allow me to provide the highest quality of care to patients. I also see myself taking on more responsibilities, possibly in a lead CNA role, where I can mentor new certified nursing assistants and share the knowledge I've acquired. Throughout my career, I've always aimed to make a meaningful difference in the lives of my patients, and I am committed to continuing this mission with dedication and compassion. Question number 23. What hours can you work? When answering this question, it's important to be honest about the times you are available. Think about your personal commitments and whether you are pursuing higher education, which may interfere with the shifts you are scheduled for. Here's how you can structure your answer. But again, remember to customize it to fit your own situation and obligations. I'm flexible and willing to work a variety of shifts to meet the needs of the facility. I understand the demands of healthcare, especially in a role like a CNA, often require early morning, late evening, or overnight shifts, as well as weekends and holidays. In my previous roles, I have worked shifts across all these times, including rotating schedules, which has helped me develop a strong ability to adapt to changing schedules while maintaining high-quality care. I'm currently available to work full-time and can start immediately. I'm also open to discussing part-time or specific shift patterns if that's what is required for the position. And finally, question number 24. Do you have any questions for me or for us? Thank you for the opportunity to ask these questions. First, I'm interested in knowing more about the day-to-day responsibilities specific to the CNA position here. What does a typical shift look like, and what are the common challenges certified nursing assistants face in this facility? Secondly, I'd love to hear about the team I'd potentially be working with. What is the current team structure, and how does this facility foster teamwork and communication among the nursing staff? Additionally, having worked previously in both long-term care and acute settings, I'm keen to understand how this facility supports continuous learning and professional development for its staff. Are there opportunities for further training or advancement? Finally, I would appreciate any insights you could share about the patient population here. Understanding their needs and expectations would help me tailor my care effectively. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.